So back in high school, which was about 12 years ago, I was doing ballet, and I felt a snap in my hip, and it dropped me to the ground, and I was not able to externally rotate my leg for about 3 months.
Yeah, and that was over 10 years ago.
Yeah. So they got an x-ray, they said that they didn't see anything, they didn't, so I was fine.
Yeah.
In November, I was just leaning with my leg up.
Of last year?
Yeah, this last year.
Yeah.
I was just leaning with my leg up on a chair, and I pulled it down, and I couldn't put any pressure on my leg. It was just, for about 2 days, it was just...
But after the dancing thing, did you recover and then you were fine for 10 years or 12 years?
Eventually, I had limited range of motion, but I didn't have any pain.
Okay,
Yeah.
so that then changed in November?
Yeah.
Okay. So you were moving, not really extreme position, and it really almost dropped you?
Yeah.
Okay. So what's happened since that time?
I just could barely walk, go up and down stairs until February. Then I was able to finally start walking again and such. It's been really random when I've had really bad pain versus like 2 days ago I was like, I'm not in any pain today. So, but then it came right back the next day.
Okay. So it can be okay and then really not okay.
Yeah, and it's been weird because I've been trying to pay attention. I'll go to the gym and I'll do some walking, or I'll do some like strengthening exercises for my hips, and sometimes that'll help a lot, but then other times it puts me back in like a week or something in progress.
Is there a pattern to it? Like, is there a pattern to the activities or movements that make you hurt?
Not that I've been able to pick up on.
Okay. Do you find it easier to sit or stand or drive, or worse to sit or stand?
Standing is better. I go to SU right now, and I can't sit through a whole class, so I have to stand up.
Okay. And driving?
Yeah, driving is same thing.
Yeah. Is it just the right hip?
Yeah, I've noticed I'm starting to have problems in this hip, but I'm assuming it's the compensation.
Okay. And where is your pain now located?
It's mainly located... Sometimes it's front hip flexors, sometimes it's mid-glute. It used to be right in the side.
Yeah. Does it go down your leg, or?
Not really, no.
Okay. And how's your back?
So painful.
Do you think it's a similar problem, or is it a different thing, or what?
I think it's a similar problem. I've been trying to strengthen my abs to see if that's been the case, and it helps some, but...
Doesn't resolve at all?
No.
So tell me now what you've tried to do to help this hip pain.
I've tried yoga, and that made things worse.
Yeah. Often does.
It often does.
Yeah.
Oh.
You have hip impingement is what you have.
Oh yeah. So any kind of movement is going to be.
Well, certain movements.
Okay.
You have a hip shape that I'm going to explain to you in a minute, but you have a hip shape that is predisposed to this hip problem pretty much since your hip development was finished in your early teens. You're not like deformed or really weird, but you have you have a hip shape, namely your hip socket is too deep and too constricting, and when you move certain ways, things impinge.
Okay.
So tell me what you've tried.
I've tried, like I said, I've tried yoga, I've tried stretching, I've
any medications, any specific therapy?
No. I have, I've tried just doing some external rotation with like a band. And
on your own, or did you do that with a therapist or a friend?
On my own. Yeah. I worked for a physical therapist for 2 years, so
good.
I was...
You know some things.
Yeah.
Good. Any medications? Did you mention that?
Ibuprofen or Tylenol when I can't handle it.
Yeah.
But
good.
that's it.
Nothing stronger.
Yeah.
Any injections in your hip?
No, besides the MRI
injection,
and that was awful. I couldn't...
Made it worse?
Oh, yeah.
For how long?
About a week.
Yeah. And then it settled down?
Yeah.
To about the normal? Okay. How's your general health?
I'm pretty good.
Yeah, you seem healthy. And you said you're studying?
Yeah.
Okay. What are you studying?
Exercise science.
Oh, are you?
Yeah.
Good for you. Okay, great. So let me see you walk. Yeah, bit of a limp.
Really?
What? Just a bit. Nothing crazy. Obviously, what's been the frustrating thing about this thing, this problem?
I love exercise. I love to work out.
Okay.
And it's put me into a depression.
Okay. So not so much the process of figuring it out and getting it treated, it's just that it's a bummer to be in pain is what you mean.
Yeah.
Yeah. Just lay back and let your feet. So can you crunch your left knee up to the left side?
Oh my gosh.
Crunch up with your hands, hard as you can find it. Does that hurt? Either side?
No.
Okay, come on down.
There's a little pinching, but it's not painful.
Okay, now right side. What?
Yeah, it's tight, it's painful.
Yeah. Let me take the weight of your back. I see. Yeah. That's the pain, is it? Yeah. Same thing or not so bad?
Not as bad.
Okay. And if you press around your hip, are there tender areas or is it deeper?
A little right here.
Yeah. Right in the flexor.
That's about it.
Yeah. Come sit up. So I looked at your x-rays and your MRI before I came in, and the first thing is you're not like deformed or weird or nothing crazy, but as I mentioned before, so the hip is a ball and socket joint. You have the femoral head that sits in the socket, and you want that socket to be covering but not too much and oriented properly, facing forward a slight bit and not backwards. Your hip socket is much more covering than it should be, and the front wall is more prominent than it should be. So when you move like that, your femoral neck is impinging on that edge of the socket, and there's a bumper of cartilage that sticks out about that far called the labrum, and it's torn. It's probably what explains the pain you talked about 12 years ago or something when you were dancing, and I think that's why you started to hurt in November, and it's why you hurt now. And it's not an uncommon cause of hip pain. It comes in all different flavors, and everybody's different, but I think what's caused this for you mainly is the shape of the hip socket. There may be some prominence of the femoral neck, but the predominant problem is that socket shape.
Okay.
You can keep doing what you're doing. I mean, you're doing all the right things. You're a very active woman, you're very athletic, you're working, you work with a physical therapist. I mean, you're doing all those things, and those you can keep doing. No one should leave my office thinking that surgery is the only option, right?
Yeah.
But you're sounding like someone whose symptoms aren't getting better, and you have a hip shape that is a fair bit off from what it should be. So yours is a hip that, it's not only because of pain that I talked to you about fixing this, but your hip is at a higher risk for further damage that then becomes a bigger problem to fix, arthritis and so on. The surgical treatment for this is arthroscopic surgery. Basically, I look inside the joint and I see where the damage is, and I confirm and how bad it is. I then treat the damage depending on how it looks. So I would expect to see damage to the labrum that sometimes is just fraying that needs to be smoothed out, but other times, and quite commonly in this type of what we call pincer impingement, it can be quite severe and require reattaching the cartilage back to the bone if it's repairable. Sometimes the labrum is trashed and can't be repaired, so, and it's hard to say from your MRI if that's the case, but I prepare myself for anything that I can find. But the big thing I do then is make the bony shape better. So the big thing for you is make the hip socket less deep. So I literally take bone away from the edge. Not a ton of bone, like 2-3 millimeters, but enough so that when you bend, you don't rub or impinge. I may also take bone away from the femoral neck, but I think that's the secondary thing here. It usually takes about an hour. You go home that day. There's always 2 incisions. They're quite small, but always 2. I make a third if I do a repair on the side of your hip. You can put all your weight on it from the beginning, but I send you home with crutches for a week and then a cane for 3 weeks to lean on and avoid a fall. Your surgery pain settles down in a few days to a week or so you're icing and elevating. I usually do these Wednesdays, and people get back to like school or desk work by Monday.
Okay.
But you're going to be stiff and sore. Like the big healing takes 6-8 weeks. That's where a lot of the healing happens. And during that time, you're walking, and gentle movement like station bike and even elliptical are fine, but really gentle. And then at 6-8 weeks, I see you back, and then we start to ramp things up, and then you start to work on motion and strength. And those things get better for months, like sometimes 6-8 months. And complications, risks are rare. I mean, infections and femoral neck fracture and blood clots can all happen, but they're quite rare. And the hope is that you get rid of all of the thinking, and what we do see in about 85% of these cases is people's pain goes away and they resume normal activities. But a lot of it depends on how bad the damage is before we get to it, you know.
And the MRI doesn't really
Well, it
show
tells me that
well.
there's not a lot of damage. MRIs are not perfect tests. You've got tearing of the labrum, and the cartilage, the really important cartilage that covers your bone, what we call the articular cartilage, looks good. But it's way more accurate when you see it. And sometimes where there's fraying and roughness that we just don't appreciate on the MRI.
Okay.
So, the one thing, you have an X-ray of your pelvis that's it's showing you more of your lower back than I'd like it to. If you were serious about getting this fixed, I would have you get a better pelvis X-ray than you've had done. The lateral one you had done is fine, but the pelvis X-ray, which I use to measure angles and see how much bone I'll need to remove, I would recommend you get a better pelvis X-ray first, before if you decided to have surgery. So yeah, what questions have you got?
So with like the amount that you can tell of the severity of my hip, I'd rather not do surgery if possible.
And you don't need to.
Okay.
But it's just really hard to tell you if this is going to get better on its own.
Yeah.
You have a mechanical reason for your pain, and the shape of your hip is not going to be changed by what you do.
Right.
You can wait. I kind of saw that in your eyes when you started to talk about this. You're frightened to death of surgery, and I'm sure you don't want to be here. You have a real reason though for your pain, and I don't think it's going to get better, but it might. Just don't let this go too long.
Okay.
Like if you're sore like that and you can't sit and drive and move, and you're 2-3 months down the road, we're getting into the summer and you're still that way, don't ignore that, because, you know, as I was saying to you, the outcome of surgery has a lot to do with the degree of damage that's there before we get to it.
Right.
And that's what you control. The other big factor that controls the outcome of this is how good a job the surgeon does at addressing the problem, you know, and that's what someone like me can control, you know.
Right.
So, yeah, no one wants to have surgery. I mean, especially a young girl, woman like you, no one's like to have surgery, but, you know, eventually it gets to the point where it becomes clear it's not going to get better, and that people just elect to have it done because it's the lesser of two evils, you know.
Yeah.
But I understand no one wants to have surgery. That's not fun for anybody.
Okay. That's good. I'm glad I'm not.
You're not weird
destined
at
to
all?
have. Well, I guess. I don't know.
No, your attitude is not weird, and your anxiety is not weird at all. Just don't ignore this.
Okay.
Like I said, I need to get an X-ray, a better pelvis X-ray before you have the surgery. So my sense is you're going to sit and think about this for a while, and you're going to digest what I've just told you, and you may go off for a few months, which is fine. If your pain goes away and you can resume normal life, carry on. Come back if it starts to hurt again. If your pain doesn't go away and you start to get your head around surgery and fixing this, you probably will be smart to come in for a new X-ray.
Okay.
You need to have the pelvis X-ray regardless. So the one annoying thing is if you drove home today and you decided to have surgery like as soon as you could, you'd have to come back to have the X-ray. I really need a good X-ray for this. It's really important for me to know the real shape of the pelvis, because I compare your hip and your socket shape to like all of the averages, you know.
Right.
So
That makes sense.
yeah.
Do you think this could have anything to do with? I've noticed. I thought it was from the original injury back in high school. I have an indent in my hip right here.
I don't think this causes your indent.
No.
You
Okay.
know, the one thing that may cause the buttock muscle, the gluteus maximus, to look different than the other side is lack of movement, pain, inactivity leads to muscle atrophy, as you're probably aware, and that can make the dent look deeper. But this impingement problem and the labral tear and all the other stuff I was telling you that I would fix at surgery, that'd be really weird to cause a dent in your buttock, your gluteus maximus muscle.
Okay.
Yeah?
Makes sense.
So I can't explain that one.
That's fine. Thank Thank you.
Yeah, you're welcome. Yeah, so I'm gonna leave it up to you now to figure out what you'd like to do. And if you decide to have surgery and we're down like 2-3 months from now, you'd be smart to come back in for a proper recheck. Yeah.
Okay.
Okay?
Thank you.
You're welcome.